Historically, marine natural products have always been used to find really toxic compounds, toxic drugs. So they look for anti-cancer, antibacterials, antiparasitics. But actually, there's a lot of compounds in the ocean that aren't toxic. And so that's sort of what we're looking at. We're looking at things that are in these bacteria on the coral reefs, which are able to modulate the receptors and activate the receptors in your brain. The current research is actually looking on pain and depression. Because if you think about it, someone who is depressed, a small pain is going to feel much worse. Someone who's always in pain is much more likely to be depressed. And so what we're looking for is we're looking for a compound which can affect both of these disease states, but by acting through a single receptor. This past summer, we spent a week in Curacao. We scuba dive and snorkel on the reef, collect bacteria. They're called cyanobacteria, so these are unicellular bacteria that grow in colonies. And then we bring these bacteria back into the lab, extract all the chemicals out that they make, and then screen them against all of the receptors in your brain. So we look at around 50 G protein coupled receptors, transporters, those kinds of things, and then look at what the affinity is. Once we know the affinity and which receptors it might hit, then we will go ahead and move forward and isolate pure compounds and try to determine the structures of those compounds, as well as put those fractions and compounds back into in vivo tests to see if they actually work in animals. I typically have 2 to 3 pharmacy students along with my 2 graduate students working in lab at all times. And it's nice to see them kind of have that aha moment when they get to that point of they're not just doing what they've been told to do, but they're thinking about the project and realizing that there are no hard answers to the questions that we're asking in science and in research, but that they have to explore the answers on their own. Duquesne, and especially the School of Pharmacy, are a special place because we have access and the ability to do cutting-edge, top high-level research, but everyone is very accessible. Professors are in the labs doing research, they're in the classrooms teaching. You build real relationships with the professors and with the students,